to talk about mental health. And you guys haven't done. So I will be talking about mental health, some of the diseases, and the drug package. I gave you some packages, the questions, and I want you guys to practice your questions. The drugs are very important, and I will be talking about mental health. The first thing is, before I go in package, I wrote it down few things here. And we all remember we have done the Maslow's theory. And what happened when we are mental problem, physical problem can be sometime your infection, but for all human growth and development, remember, this is very important, the Maslow's theory. And what did we learn in Maslow's theory? What is the first thing? We start from the bottom. And what is the first thing in the bottom is physiological need. To our growth is very important that physiological needs are met for every individual. Now, what are the physiological things are? Our food, water, and shelter, your sleep, and all that physiolocal need to be met. Any needs are missing, we are not going to be able to live very healthy. Second one, we all know, is safety. Now think about applying the same application for when you're dealing with your patients are. Now what does safety mean? Safe environment. You got to provide a safe environment. From the childhood, the child is born. Is the first thing is the safety. Are we clear? And meeting the physical need. Now, anytime you're not safe in the environment is going to affect on the personality. Same way your patients, not even when they're mentally, but we are talking about anytime we're dealing with anyone and we are dealing in patient's environment. Patient comes in, make sure we have enough. So half of your time we got to think about provide safety, safe environment for your patient. And the third one is love and belongingness. Do you think, does it affect love and belongingness? Yes, we got to be loved. If you're not loved, we don't know where do we belong. Do you think our personality is good? No, it's going to be affected. Now, same thing, this is very important, affecting on mental health. When we have love and belongingness is not there, it affects the individual. Then we are going esteem. What is the meaning esteem? Now we got all these things in our life, and what is that esteem word is? Self-esteem. What is self-esteem is? You feel competent. You feel you have achieved. Now we all are studying for our exam. Now what happened when you pass? Oh, your esteem is very high. Why? Because we know we have accomplished the goal. So everybody's life is very important to feel your self-esteem is important for us. After the self-esteem, it comes is what? Self-actualization. You have a good personality. You grew up good. So remember, to have a growth for us, for anybody, where do we have a problem in mental health? When we are lacking any of these things. So very important, how do we deal with our family, with patients, and how we are going to learn. So your questions, whenever we are thinking about we are dealing human being, you have a patient who comes sick. Do you think you are going to provide safe environment for your patient? Yes. Are we going to think about giving them love and belonging? What does it mean, love and belonging? Answering their call light. Talking to the patients, giving them time to understand what is their problem are. Now, if you go answer your call light and say, I'll be back, and you never go back, what happened? Does the patient trust you? No. So what happened here? Patient feels nobody cares here. So we got to think to provide that. So very important, these things to make you self-actualization. Mental health is very important to feel self-esteem. Your esteem is good. You know you can do it, and you're growing good. That's very important for all of us to know. Here, I wrote it down, where before I'm talking about the mental health, and when I repeat those wording are important, what is neurosis word and what is psychosis word. Now, when we see in your questions or in your patient's diagnosis, patient has psychosis. What is the meaning psychosis? Out of reality. That's a severe mental problem. And what is out of reality means is they're not in the real world. Very hard for them to deal. So any diagnosis, when you're reading in your patient's chart, you're doing a question, what do we need to know is if there is a question, or if you're looking at a patient's diagnosis, psychosis, the meaning is patient is out of reality. That means he's really having a mental problem. And what is the mental problem are? We are going to talk about schizophrenia. Are we clear? And we are going to talk about more problems which are more really psychosis. But what is neurosis? What is neurosis is not really psychosis. What is neurosis is, the word comes, neurosis comes from our stress. And what does it comes from? Nervousness. So when we are talking about neurosis, it's not really is a mental problem, but yes, it does come when you cannot handle the stress and you cannot handle, the word is called what? Is the nervousness. And what we will be talking about, then we are dealing about phobias. Phobias is one of the disorder, and that's in the package. So I want to clarify two words here. In mental health, psychosis and neurosis. Everyone is okay? Psychosis is bad. Patient is out of reality. And when I'm going to talk about schizophrenia, then we will be talking about is what is schizophrenia will go here is more in psychosis. The third word, even it doesn't come, but in our life and when we have everyone's life, we all have the same problem, but we know how to handle our problem. Are we clear? And what do we use to handle our problem? Our defense mechanism. And what is the word defense mechanism? That means you can handle the situation. And that's normal. We all have, no, do you think we don't have anxiety in our life? We all have, that's normal. Do you think we don't get depression in our life? Yes, we do. There are certain time comes, we all go through with the phases, but you are strong enough and you can feel and you can get by with what? By using some of the defense mechanism. Are we clear? And so there are wording. And when I use the word repression, now we all have learned the word denial. Everyone has done the question and we know what is denial. When you hear, I'm having this problem, we say, no, not me. I never had this problem. Patient heard that they have a cancer. Patient said, no, I think I'll go another doctor. I may confirm I don't feel I have this problem. So what is that? Denial. Very hard to accept the truth, very hard to believe that we are sick, very hard to believe what's going on. So what do we go first? Denial. Then slowly we move on and we start accepting. So everyone knows the wording, psychosis, neurosis, and defense mechanism. And very important, remember, now when we have learned in term 1, and what did we learn in term 1? This was the basic, first thing we all have learned. But that is the basic thing you apply in your question and apply for our patients in your questions as well as dealing everyday life with our patients. I will start this package, and we all have package with mental health. And I gave you a few wording before I moved on, but now I will start with mental health, the phases of therapeutic nurse and client relationship. Now, we do have client and nurse relationship every day in our life. And every day we got to maintain that relationship in dealing with our residents or with our client. Number 1 here in mental health, I said here, is phases of therapeutic nurse and client relationship. What is number 1 is pre-interaction phase. What is a pre-interaction? What is the word interaction? When you're going to meet your patient, you're going to see them, you're going to take care of them. So what is pre-interaction means is underline the word first contact, before the nurse first contact. Before you are meeting your patient, before you're going to see your patient, before you're going to have a contact. That word is called pre-interaction. Everyone is okay? What is pre-interaction? Before the patient's contact. Before patient is coming in, or you're going to see, you already look the patient chart. You already know about your patients. And a lot of time when you see, you're going to see the doctors, I have noticed that. Doctor knew about me already. And then they start talking to you. So what is the word is called pre-interaction. So what is pre-interaction means? Before the patient's contact, you already know about your patient. Everyone is all right. Number 2 is orientation. A lot of questions can be, what do you do when you're orientating a patient? We are orientating a person. What is it important for us to know is, number 1, is underline the word trust. Anybody you're going to see, do you want them, they should trust you? The first impression is always good. You went to the patient and patient is talking to you, patient trusted you and believed you. So what is the first thing is during orientation? I want you to highlight the word trust. Make sure patient and you relationship, we develop the trust. And second word is very important is the boundaries. What is the word boundaries? In the first line, in the same line, boundaries are important. Third word is time frame. Now those are important, we all need to know. We are dealing with patient, mental health. And mental health or otherwise, we are dealing with all our patients and we are nurses and we have to know orientation time. What do you do? Anywhere you go orientation, the first thing is what? Develop the trust. Number 2, you got to give the boundaries. What is the meaning boundaries? You let them know what can they do, what they cannot do. Are we clear? Now, if patient is a smoker and our facility is a non-smoking and we didn't tell the patient and patient starts smoking, won't he question, how come you didn't tell me I was not supposed to be smoking? So all the rules and regulations and patient's right must be informed to the patient when in orientation. Or in your med search, you do it on time of admission. So when you're orientating, what is the second line is time frame of relationship. What is the meaning time frame? How long are we going to treat the patient? What is the meaning is here, how long? Another word, your question is, when your patient is going to be discharged, are you going to tell them in orientation? Yes. Remember in med-surg, when do we tell a patient to be discharged? On admission. Same here, we are talking mental health. When do you let your patient know that they're going to be home? In orientation. Everyone is okay? So what do we, in your question, you're meeting your patient in orientation, and what do you do? Number 1, relationship, trusting relationship. Number 2, make sure we tell the boundaries, what they can do, what they can't do it. And number 3 is in the second line, time frame of relationship. We must let them know how long are we going to treat the patient. You don't want to surprise them, you're going home tomorrow and give them the papers. They've got to be prepared. Our job is we admit a patient, we discharge a patient, every information should be told right there. Maybe approximately you're going to be here and patient is aware. Those 3 questions will be asked for you. When do you tell your patient about orientation time? Is time frame of discharge, boundaries? When do you develop your relationship with your patient on orientation? The third thing is working phase. What is a working phase? Whether it's a med-surg, whether it's a mental health, we are working with a patient. And what do we do in working phases here? Underline the word listening, active listening, and patient you're listening, and in the end of the line, underline the word encourage patient to make them independent. What do you want them to be? Making independent. So when you're working with your patient, what is your goal here in mental health? Same in med-surg, but just the wording we are talking here. So what is the thing we said here in working phase? Number one, listening. You got to pay attention to listen to their problem and the patient's problem. And what do you help them? Coping mechanism. Remember, I said the word coping. How can we deal normally in their life? Because this is a mental health we are talking. So you want to let them learn when they're going home, how can they be able to live their own? And the last word is independence. Do you want the patient should be able to live when they go home their own? So you teach them how they would be independent. So question, last line, in the second line, in number 3, working phase, problem solving and coping mechanism. In working phase, you are listening to your patient, you are teaching them how to be able to do their problem solving, how they're going home, and how they can live independent. Last one is termination. Termination or separation word is what? Discharge. Patient is separation or termination, write down the word discharge. But they may not use the word discharge. They will use the word, what do you do when patient is terminated? Termination stage means the discharge stage. What do you do when your patient is going home? Number one, prepare your client. Prepare your patient to be discharged so they can function independently. Evaluate. What do we evaluate? What is important for us? Do we have the goals for our patient? Yes, we have learned in the care plan. So what is it important here? Before you discharge your patient, what is it important to see the patient goals are met? Are we clear? So these are questions. They will ask you, what do you do when you're having a discharge? When patient is going home, you must meet their goals. Are we clear? And so what are the goals were? Patient was able to do this, now is he okay to go home? Encourage the client, underline the word, express feeling of termination. Because when you're going home, there's a lot of anxiety. Can I take care of myself? How would I get the help? So what do you do when before you discharge your patient? Check your answer, check the goals. Your goals are met. Your patient is okay. Last word, refer. Referrals. What is the meaning referral? Is if they are going refer, you're going to refer them any support therapy they needed, any help they needed, any therapist they're going to follow. Are they going to follow your doctor? So what do we do? Refer the client for support system. Everyone is okay? I'm repeating again. The phases of therapeutic relationship as a nurse, what do we do? First is pre-interaction. Before you see your patient. The meaning is pre-interaction. Orientation time, you make sure you let the patient know first thing, develop the trust, boundaries, and time frame. Third one, I said, is working phase. When we are working with a patient, listen to them, active listening, and teach them how to understand coping mechanism and encourage independent and teach them when they're going home before they are terminated. Fourth one is termination means discharge. Before you send, whether it's a mental health or even nursing home or even acute hospital, patient must be terminated when they have made the progress. And what did you check before you send your patient? The goals are achieved. And the last line are very important, is what do you give when your patient is going home? Referral. All the referral, you must let them know what appointment and where patient is going to be and what they will follow up. So these are very important, whether we are working in a med-surg or we are working in a mental health, but these are important to apply. Now there are two words in the next paragraph, involuntary admission and voluntary admission. What is involuntary admission is when it is applied. Involuntary means without patient's will. Patient is not going to go to the hospital, but we are forcing patient should be treated. What is in mental health is involuntary admission, underline person who is mentally ill. Patient who is mentally ill, and underline the word danger to self and danger to other. And the second line, underline the word immediate attention or immediate action. So what do we do? A person who is not safe to be in a hospital, maybe in a home environment, what do? We got to force that person to go to the hospital. So in your question, they're going to ask, what is involuntary admission? So what is involuntary admission? Person who is mentally ill, who is not safe for himself or not safe for others. You have a patient who's hitting everybody. Do you think you will allow that patient to hit everyone? No, that patient needs the attention. And where do we treat them? In mental health. So what do is that patient involuntary admission, mentally ill, danger to self, danger to other, and they need psych treatment, require immediate attention, and how will he be discharged? Underline the word by physician and add there by mental health, or state to state varies. From each state they vary the mental health program. So who will discharge them? By the mental health, because they are treated in mental health. So remember, they cannot request, I want to go home. Now, otherwise, if your patient is voluntary, I'm going to move on. What is voluntary admission? Patient is seeking advice, and patient wants to be in the hospital. Client seek admission. Client is okay to be for admission. Client is free to sign out, and by physician. We all need a doctor's order. Are we okay? You guys are okay here?
Yeah.
Okay, so what is involuntary? I said, if you have a question, let me repeat. Involuntary admission is danger to self and danger to other. And we have to force them to be in the hospital, but how do they be getting discharged? They cannot request, I feel I'm okay and I'm going home, until the doctor will give a order to be discharged, and I added the word by mental health, or it varies from state to state. That's all, the ending the word, and you can add there. What is voluntary admission? Patient is okay. Patient agreed to go to the hospital, and patient or client is able to sign out with physician notification. And now if you're detaining, underline the word. Detaining means without patient will. If we are going to keep them in the hospital, it will be called imprisonment. And what is another word is? False, right? That's not the patient's will, and that will be against the patient desire. So that will not be good. And voluntary admission. So everyone is okay. The two wording, involuntary and voluntary. Involuntary we are using for mental health patient, and is only decided by the physician to be discharged. Now I'm going to move underneath on the same page is level of psychotherapy. The meaning is here, we are treating a patient how? And you will see the wording in your question and in the treatment plan. What is in the treatment plan? We have, number one, it says milieu therapy. And that's a very good wording, and everyone should know because they're using in the testing, and we must know the wording milieu therapy. What is the word milieu therapy? Is physical and social environment. And second line, you highlight the word safety. Safety is priority, and write down the word safety is to give a safe environment. So what is the meaning is here? The patient is in the hospital. So milieu therapy means safe environment. And what kind of environment? Physically as well as social. They are meeting the environment. So that patient is treated in under supervision. Then you have the third line, by the staff, And what are the steps? Then you skip 2 more lines, and it says by RN. You have the nurse there. You have PT, OT, and they have therapists, psychologists, psychiatrists. So every team of people are working towards the goal is to meet the patient's need. So we are talking about here is milieu therapy. What is milieu therapy? Let's remember one word, safe environment. Physically, patient is safe. Socially, patient is safe. Next is called focus therapy. We are focusing the therapy for our patient and how? Underline the word positive changes. You want to focus positive, that patient is going to be good and towards the goal. So what is your focus? Whatever your patient's goal. So when we are giving a patient outline, patient is admitted, what kind of treatment are we going to apply? So I'm on page number 1, and I'm repeating, those who just came in, the milieu therapy I just said. Milieu therapy is very important word. Everyone should know safe environment. We are putting a patient in a safe environment in the hospital with physical and social environment. What is a focus therapy? Underline the word positive changes in treating the patient's goal. And again, you have all the treatment plan. Third word is supportive care. What is supportive means coping mechanism. You are helping your patient, or we are helping here to make, supportive means patient is having a problem to make a decision. So underline the word, you are helping patient to make a decision in safe, caring environment. Now we will move on to the next page. And on next page, I have here re-educating. Now sometimes it's not really they don't know, but you got to re-educate. And sometimes in your question, which patient are you going to re-educate? Underline the word psychotherapy. And which patient you have reality, cognitive. What is the word cognitive? Cognitive when you cannot make a decision. Alzheimer patients comes under what? Cognitive. And then we go modification and coping skill. So what are you doing? Coping. Let them learn how to live. So these are all kinds of wording we have for the client's treatment. Reconstructive therapy. What is reconstructive therapy? Underline the word psychotherapy and psychoanalysis and changing life. Second line, cognitive reconstruction. Reconstruction, you are helping them to reorganize their lifestyle. We are reconstructing the personality. So mental health, little bit wording is very important. We understand re-educating, reconstructing. The some problem in mental health, we have behavior problem, patient's behavior. So now moving on the same page, it says behavior therapy. What is behavior therapy is? Number 1, desensitization. Some of your question, some of your patient are desensitized. And I'm going to talk a lot about desensitization treatment when I'm moving on some diseases. And what is the meaning is here, desensitizing is, it's a behavior therapy, don't underline, I'll speak the wording, which exposed to increasing of feared stimuli. Second line, underline fear. And write down the word with fear the word is called phobia. In your question, what is phobia word is? In mental health diagnosis. And what is phobia means person is afraid. And what do you treat them is by desensitization. Everyone is okay? Question? I will be talking about phobia. When I'm going to move in phobia, and I will say, what is the treatment for phobia? Answer would be desensitization. What is phobia is? Person is afraid. They're not really mentally sick, but they are afraid. And that's why the word is called neurosis. Remember the word I said earlier is the neurosis, and neurosis means is in their mind. They're afraid. They don't want to get out of the house. They're staying alone. Person who's very afraid, how do you treat them? Your answer would be desensitization. What is desensitization? Removing the fear from their mind. Number 2, and behavior therapy is aversion therapy. What is aversion therapy? Underline the word negative reinforcement. This is going to be your answer. What is negative reinforcement? Means changing the behavior. Now, what is the word negative? When we are talking something bad you're doing and it affecting your life, that's your negative. What is positive behavior? We all are studying hard to pass the exam. That's a positive behavior. What is a negative behavior? Someone who's repeatedly drinking, taking drugs, going home, destroying the family. Are you going to encourage them or you're going to discourage them? We are going to discourage them. And what would you talk here? Patient's behavior would be what is aversion therapy. You want to change their behavior. How? By talking is what you're doing is affecting the others, affecting the family. So what is the two very word to change somebody's behavior? Now you have a good behavior and same patient has a good behavior and patient has a bad behavior by their doing some other thing, taking drugs could be affecting, maybe alcohol. How do you want to treat them? By talking aversion therapy, talking to them negatively. If you're doing this, your family is destroying. If you're doing this, your job is affected. So remember, what is the word? Aversion word is negative. Everyone is okay, negative? You're talking about negative. Positive means you want to encourage somebody to improve. Now, cognitive therapy, let's move. So if you remember the main wording, I'm having you highlight the main wording. It doesn't matter how much you read, we got to understand the wording. So what is desensitization? Where do we apply? Where do we apply desensitization? Phobias. And what is phobias are? Fear. And what is phobias come under? Neurosis. Are we clear? See, what is desensitization? Word is removing the fear. What is aversion therapy is? What is aversion? Negative reinforcement. You are talking to change the behavior. Cognitive therapy. What is cognitive therapy? Sometimes you are giving psychotherapy in cognitive. We used the word before, re-educating word, and that also in cognitive. But let's underline under cognitive therapy. Now what happens sometimes your behavior changes. What is mental health? Our lifestyle start changing in mental health. And how? Underline the word how. It determined by the way which he or she thinks about the world and his or her place is individual cognition. So what is cognitive means is how you think. Now what happens sometimes we say, oh, I hate this world. Because why? We had some problem in life. I don't like to have more friends. I can't trust them. Why? Because they were not trusted before. So what is cognitive? You are changing. Underline the word how she thinks about the world. What is mental health? Mental health, why people are going under depression, how we are moving away from the world, because how it has affected you. Are we clear? So what is another treatment, cognitive therapy? You are preparing the person, how they are thinking about others, thinking about the world. You have a good life, you know everybody, you have been loved, you have a healthy life. But there are people who have been mistreated, they have been abused. Now what happened to them? They think totally differently. So what are we doing here? We are changing their way of thinking about the world and about the thinking. Next is group therapy. Now everyone is okay. What is cognitive? You're helping the person to think about how they are thinking about the world. Thinking process, mind you're changing. Now we will move on. Group therapy is a type of treatment. We are treating our patients with group therapy. What is a group therapy means? We put couple of patients together. Maybe 10, maybe 5. So group of people are together and we are treating them. And they're helping them to treat themselves in mental health. And what is group therapy? You have maybe 10 patients and we divide it and we are going to treat them in a group therapy. So your questions are, and how group therapy is done, there are 3 stages. Any questions on that? Would be 3 stages. Before you develop a group, you got to know the group therapy, and it says initial stage. What is the initial stage? Is before, and in initial stage, your patients are, you made a group, now they're meeting together, that's your initial. So highlight the word initial stage. If they ask you, what do you do in initial stage of group therapy? Underline the word members get acquainted. You have more people here. You got to know each other. Are we clear? So in group therapy, you want them, patient, to know, get acquainted to each other. And second line, their role and responsibility. So we are forming a group of people and they need to know. If you don't know, you're not going to be comfortable to talk your problem. So this is a group therapy. They're working together. The first thing in initial therapy, the group know each other and they get acquainted. The word is called acquainted. And what would you tell them? What is your role? We are not here to discuss other things, but this is what we are going to talk. This is what the time we are going to meet together and we are going to discuss the problem. So what do you tell in initial stage? Number 1, let the group know each other. Second thing is important, what is their responsibility and what is their role in the group therapy? Second is working phase. What is the working phase? Underline the word members work together. They're working together. They should feel comfortable, and underline the word solving their problem. So what are we doing here? They know together, they know each other, they're working together, and what are we doing here? Solving the problem. So they're talking about their problem, why I'm here in the hospital, this is my problem, how do I deal? Other will say what they're doing. So they're working in a group. So that is called working phase. Third phase is called termination phase. What is the meaning? Termination again, discharge. They're going home. And what do you want in this working, in the termination phase? Underline the word, learn to deal more realistically. Now patient is learning when they're going home what? The word is realistically and comfortably. They're real. They can do truly how they can go out and live their life as a normal part of human experience. So how we are learning it as a normal human experience. So we all know there are the group therapy in a mental health, and they have 3 stages in the mental health for the group therapy: initial stage, working stage, and termination stage. What is initial stage? Patient know each other, their responsibility, working together in working phase as realistically and solving their problem. The third stage is termination. Anytime they use the word termination, means they're going home. And they should go home realistically, comfortable, that they can live in their life. Now I'm moving on, the diagnosis, anxiety. We all need to know anxiety question, and every time I will have you highlight the main wording. So what is anxiety is? Do we all have anxiety? Yes, we all have anxiety. Is normal. Underline the word normal. Anxiety is normal for all of us. And what is in anxiety is coming normal response to what? Why do we get anxiety? Underline the word stress. Your anxiety level goes up when we have more stress and threaten your values. Underline the word results when values are threatened. Our values are threatened, it's affecting in anxiety. Now we will go our types of anxiety. We have normal, acute. What is acute? We all are normally healthy. We all have some anxiety level. Are we clear? Number 2 is acute. When we are saying acute, underline the word is immediate or imminent loss. All of a sudden, something lost in the life. Maybe a job, maybe somebody died, can lead to anxiety. Maybe we have some changes in life. or sense of your security. What is acute means? Something happens immediately. What is chronic means? Underline the word daily activities. What is our daily activities? Going to work, going to school, leaving children in the school. Now what is that? Doesn't it cause anxiety? Yes, I got to get up at 7 o'clock, I have to go to work, I have to drop my daughter to school, whatever we have to do. What is chronic means is your daily life. Everyone is okay? Anxiety is normal. Acute means all of a sudden. Chronic means your daily process. Now level of anxiety in your questions or in your patient's diagnosis. Mild anxiety. Mild is okay. We all are taking NCLEX. We all have some anxiety. It's normal. If you don't have anxiety, that's not good. Because why? I'm too relaxed. I think I can pass the test. I don't care. I think I've done all my terms and I'm okay. No. We got to study more. So you have anxiety. You are here. We are studying, and that will be mild anxiety. And what is mild anxiety means is you are alert. You know what we are talking here. And perceptual field. What is the word perceptual? Your understanding is increasing. Now, if they ask you what happened in mild anxiety, underline the word motivation. You are motivated to pass the test. Aren't we motivated to pass the test? Yes. And that's anxiety. And what is it producing? Growth. So in your question, what is mild anxiety? Number one, it's very alert, very perceptual, very motivated, and your growth is there. And last word in the second line, increasing learning. If you're not anxiety and you're very relaxed, your learning is not there because you're carefree. I know everything. I don't think so. I need to know more. I've learned enough. No motivation. So when we have motivation in life, your learning is better. Number two is moderate focus in the moderate anxiety. It's underlined the word narrow. Now when you get anxiety very high, your learning process gets affected. Narrow perception and narrow learning. You're still learning, but it's slowed down because your anxiety level is more higher. Third one is severe. Severe is not good. Underline the word bad. And second line is you will go, learning and problem are not possible. And individual need direction. What do we need here? Direction. So severe anxiety, we need direction. Patient is admitted with severe anxiety. What are you going to do? Don't tell him, go to your room. What do? Walk with your patient, go with your patient and sit down with him. Are we clear? See how your questions are? Patient is admitted. So what is severe anxiety? Learning is not possible. You're telling a patient what to do, but patient will not understand. So what do we need as a nurse? We need to sit with our patient and help them and focus them in direction. Fourth one is panic. So remember, severe is not good, panic is not good. And what is panic is? Very dread and terror, impending downward and disorganized word in the second line. So it's first line, panic. The word says associated with dread, terror, and personality is disorganized. Second line, unable to communicate and function. Unable to communicate and function. What does it increase here? Very much motor activity. You're looking for your patient history. You're looking for your question. Patient is admitted. Patient has panic attack. What is the meaning panic attack is? Increasing motor activity. And prolonged panic, if they stay long time panic, is exhaustion and death can be possible. So panic, anxiety are bad. It's not good. So any questions comes, I do have at the end intervention. That means how you will deal for your patients or in your questions. Mild to moderate anxiety. Patient has mild and moderate anxiety. What do? Continue to talk to the patient. Talking helps them to relieve anxiety. Encourage motor exercise. To reduce anxiety, walking is good. Walk with your patient. Maybe take him for a walk. Why? You are diverting their anxiety level. So question are, patient has a mild and moderate anxiety. What do? Continue to talk to your patient. Relieve their anxiety. Continue to walk with them and give them gross motor exercise. Encourage them. What is your problem? Can I help you? Where I'm going to help your patients? Ask them what is the concern they have. Number 2, if you have a severe or panic anxiety and patient is admitted or your patient is having already that anxiety, what do? First thing is reduce the anxiety quickly because it's not good to keep them in a severe and panic attack. What do? Your answer may be reduce the anxiety. How? Stay with your patient. Walk with your patient. Take them to the room, stay. And when you are talking, give very simple instruction. Don't make a big statement because they're not going to understand. What did we say? They're not able to understand. Let me walk with you. Now don't stand there, you go to your room, I will come there, you have a call light, you call me. That's not going to work because he's not understanding. So what do? The best thing, I'll walk with my patient, I'll go there and I'll sit down. So what we will do here, walking and staying. So your best answer, stay. Underline the word minimize. Environment stimuli. What is the meaning minimizing environment stimuli? Is cut down the stimulation. Anybody is making more noise and shouting, take them in a quieter room and avoid them. Anybody in the room who is making more is commotion or maybe a stimulation. Underline the word motor exercise. Always exercise and keeping them busy doing something can help them. So if they give you all that answers to apply when you have a patient with severe and panic anxiety, you can apply all of them. Are we clear? Walk with your patient, talk to them, remain with your patient, environment is clear. And the last one, anti-anxiety medication. What are the anti-anxiety medications we know? Anybody we know anti-anxiety medication? Prozac is for depression, but Ativan, very good, and Xanax. Remember the word Xanax? So everyone, you can write it down, is Ativan. Ativan is very common drug we give them for anxiety, and Xanax is another medication. We got to keep knowing some drugs. And Ativan. We can also use Haldol for a lot of patients. This is a very older drug. There are a lot of new drugs we're using, and so Ativan, one of them is Xanax. Haldol is also for anxiety. So everyone is okay so far, and I will move on. Panic disorder. Panic we are already talking, but we have separately here is patient with panic disorders, cause cannot be identified. Sometimes you don't know what is the reason, and it's coming intermittent anxiety and data collection. What does the patient say when they have panic anxiety? I feel like choking, under the word choking word, and sudden fear and discomfort, and they go in 10 to 15 minutes. So when you see in your question, patient is in anxiety and patient is saying, here, I'm choking. Second line, inability to breathe. I cannot breathe. That means they are in a severe anxiety. I'm having a heart attack. They can handle the situation. Then we will go is I'm going crazy. I know sometimes we all talk, okay, I'm going crazy, even you have a lot of situations, the very common word. But think about when they have really panic. I'm going crazy, I can handle it, and it's bad anxiety level. And panic disorders, underline the word During sleep, some people they can handle, and even during sleeping time, they feel very anxiety. Panic disorders can cause, underline the word, agoraphobia. Now we learn another question. Phobia comes from where? From anxiety. Panic disorder. So if they're asking patient has anxiety and patient has panic disorder, what are we monitoring? Phobia. So what happened? You get so anxiety level, I don't want to deal my life. I don't want to see the world. And what I'm not going to see anybody. So what does it make here? Phobia, agoraphobia. Having a panic attack in a place, and they underline the word restrict activity. What do we restrict here? Our activity. So they're not going anywhere. So remember, anxiety, panic anxiety, some people cannot handle and they convert into another problem, phobia. And that is one of your questions about phobia comes from where? From anxiety. Now I will move on, the last intervention. When patient has panic anxiety, is remain with patient. Stay with your patient and attend the physical symptom. They're having a tachycardia. What happened? Your anxiety level goes up, your vital signs are going up. Are we clear? Tachycardia, you have problem in breathing, check their vital sign, look for pain, and give them anxiety medication. So we all covered with that. Everyone is okay. Anxiety question, how we will answer. Stay with your patient, give them medication, but relieve their anxiety, cut down their environment where there would be anxiety. Now I'm going on bipolar. Now what is bipolar patients are? I said the word in earlier, psychosis. Are we clear? What is psychosis means? Really mental problem. And psychosis is they're not in a lot of time reality. And so bipolar are bad. Underline the word psychotic disorder. Instead of psychosis, you'll have the word here, psychotic. And how do you differentiate bipolar are extreme change in mood? That is your answer. Extreme change in mood in the first line. What is extreme change in mood? They're extremely happy, extremely they're down with depression. So there is elevation. It's not normally, but they are in extreme of changes in mood. And they're more like a little bit schizophrenia. So underline that word. Acute mania. What is acute? All of a sudden, profound change in mood. And they are described elevated, irritable. So what does it cause their personality? Irritability. So what do they have here? Irritability. Now we will move on is delusion. What is delusion of grandeur? Grandeur word big. Rich. I'm very big. In their mind, everything is higher level. Grandeur. Motor activity. So underneath, after acute mania, we have the word delusion, and they are delusional. They're thinking false belief. What is delusion word is? False belief. And they feel they're very big. Second is increasing motor activity. They're very highly active. And flight of ideas. What is the meaning flight of ideas? Quickly changing the topics in their mind. Quick changes of the thinking process. That's a flight of ideas. They cannot sleep and eat and uncontrolled spending. These are the symptoms for bipolar. Next is, I'm going to ask you guys to add there, don't move yet, add the treatment. What would you help if you have a bipolar patient? We will be talking, they get the medication bipolar, and I will be going over the medication separately, is the lithium. And I will be talking about the medication for lithium, which is for bipolar, and I have given you a package, and I'll show you at the end some of the drugs. But very important, we know manic depressive patients, their medication. But what do you do? I will ask you to write down, number one, is remove hazards in the environment or reduce stimulation. So what do? Remove any hazards thing in the environment for safety and reduce stimulation. Don't let them be stimulated more. Number one. Number two, what kind of games are you going to put them in? Don't put them in competitive games. Don't have a competition. It's hard to meet them those competitions. Self-playing is okay, by themselves is okay, but don't put them in a group and don't them have the competition. Number three, your answer, set the limit. You got to let them know they can do this. And so what are we doing? Setting the limit. Because they're going to break the rule and they're going to do what they want to do. But you got to say, no, we can't do this here. So what are we doing? Setting the limit. Because they're busy and they're not eating. Number four in your answer would be finger food, milkshake, increase calories, because they're not eating. So you pick up the answer, maybe a finger food, maybe give them milkshake. Why? Because of calories, calorie food. And give them maybe increasing calories, maybe a milkshake may be answer, maybe giving finger food is answer. Why? Because they don't want to sit down to eat. Something they can carry, they can eat. You're drinking one milkshake, give more calories to them. So that means the diet is important. See how you're getting your question? Patient is admitted, patient has bipolar, and what would you do when patient is in a manic attack? He's not eating, you got to pick up safety, you got to pick up the diet, and then you will go next answer, increase motor activity. Walking, playing something, physically helping them to release their activities here. Simple direction. Another answer, simple direction. So everyone is okay, bipolar. What is bipolar are? They're treated with medication, but they are, your answer is extremely changes in mood. Either they're going to be very higher, they're going to be lower. And what kind of disorders they are? Psychotic. And these are the patient's problem. Let's move few more things before we take a break. Post-traumatic stress syndrome. What is a post-traumatic word is, underline the word, psychological trauma. What do they have trauma? Psychologically. An individual prone to experience, now you highlight the word, and how do they experience? By dreaming, recurrent dreaming, and flashes back. So what is a post-traumatic? They have been going in a trauma, and what is post-traumatic? Where is the trauma? Psychologically. Are we clear? So what do we underline the word? Psychologically is trauma, and what is the patient is feeling? Dreaming back, flashing back the same memory, and underline the word which are the patients are going to be on that web. If someone has gone in disaster, big disaster, in combat experience, rape victim, terrorist attack, sexual and physical abuse. Now those are the patients those are the people, because they have been traumatized with what? Psychological trauma. So what is in their mind? Psychologically. What do we data collection? What do you monitor for these patients are? Number one, what is their quality? It's traumatized their mind. Is number one, detachment. What is the word detachment? They don't want to be with others. They want to be alone. So think about people who are going and they have a family, they come back, very hard for them to go back, and what do they feel? They're not part of this world and they are detaching. So what is, you will watch them, detachment. If they can go under depression. Number two, anxiety, and very much flashes back and causing them to feel guilty about surviving. Are we clear? What do they feel? Guilty. So very much is detachment, guilt, and poor concentration. They cannot concentrate. And I want you to add there, they depend on drugs and alcohol. So how do you relieve that kind of feeling is by taking more drugs and maybe by alcohol dependency. Now, intervention, what do we do if you have a patient with post-traumatic syndrome are, number one, when we are dealing with a patient's, number one, non-judgmental is you don't judge them. They're going through with their mental problem. Individualized therapy, separate treatment for therapy. Next answer, relaxation technique, support growth. Hypnotherapy, and underline the word desensitization. What is desensitization? Is in their mind, and we are removing that from their mind is called desensitization. Now the next is, everyone is okay, post-traumatic? We must remember the word is here, is psychological trauma, flashing back, dreaming back, is again desensitization, one of the treatment. And remember, they are depending on drugs and alcohol. And also, they feel very guilty for surviving. Phobias, what is phobias are? Fear. But what kind of fear? Irrational fear. There is no fear, but it's irrational fear. So that's your answer. Now, you may not be looking only the word fear when you're saying what is phobias, irrational fear. And persist of any object or any situation, and it stays, although the person may recognize, underline the word unreasonable. Patient know is not true, but they cannot help it. So how do you define phobias are? Number one, we must know the word irrational fear. And second word is unreasonable. It's not true, but they can't help it. It's phobia. And what do? It associated with, underline, we talked about anxiety. How does the phobias comes? Remember, when I was on panic anxiety, I said by anxiety. So when you have a level of anxiety is very high, a lot of people don't want to deal with life, and they go in what? Phobia. They're afraid. Underline the word defense mechanism. What do? They repress. What is the word repression? They are repressing their feeling of phobia, and they're displacement, they're removing the fear. How? But not meeting other people or not going out. So what is the defense mechanism they're using here? The word is repression and displacement. Everyone is okay? 2, 3 wording, very important. Irrational fear. Second word I said is unreasonable. And third thing is repression and displacement. I had here defined a little bit phobia. Aerophobia, height. Some people are afraid to go on height. Astrophobia, electrical storm. Xenophobia, stranger. Agoraphobia, open space. Claustrophobia, we talk a lot on MRI. Patient is going on MRI, and what do they have? Claustrophobia, because they are going in a big tunnel. And so you remove the fear. Pyrophobia is fire. So there are kind of diagnoses, but wherever you see the word phobia, what is phobia is, what did I say the word? Neurosis. Are we clear? And what do you do for your patient? Treatment, relaxation technique, and muscle relaxation, maybe exercise. Also, pleasant situation. Let them think about the good thing. And breathing exercise. So any kind of exercise, relaxation, breathing exercise, and the next treatment, very important word is again, desensitization. Remember, we talked about desensitization, removing the fear, and which patient we talked about now is post-traumatic patient. Second treatment, you're going in phobias. And what is desensitization? Is promoting by gradually. Don't force them. Don't be afraid. There's nothing to be. It will take a time when they're getting used to it. So remember the word desensitization by gradually, slowly, introducing and taking away from fear object. Do not force the client. Forcing will cause more anxiety. All right, so we will stop here and take a little break and be back in 10 minutes and we'll continue.